All right. Good evening, everybody. My name's Todd Kovas, City Councilor Todd Kovas, and this is the 16th of our Attleboro coronavirus video conferences. We had been doing these on a weekly basis at the beginning of the coronavirus in the outbreak, and as things slowed down over the summer, we had stopped these. But now, with the number of cases starting to creep back up, we decided to do two more. We'll do one today where we focus locally on Attleboro and have a number of local Attleboro officials on. And then next week, we'll try to expand out a little bit broader at the state level and talk about how it impacts Attleboro. Um, Today, we have Dr. Patel and Nurse Joliker on from Sturdy Memorial Hospital. We're also joined by the fire chief, Chief LaChance. The police chief, Chief Hagney, may join us. We also have Superintendent Sawyer from the Attleboro Public Schools, State Senator Paul Feeney, State Rep Jim Hawkins, as well as an update from a couple of our city councilors, Kathleen DeSimone and Jay Delicio. So we'll start with Dr. Patel. Since last we spoke, Dr. Patel, can you talk about what's been going on at Sturdy and how that's been?
Yeah, sure. Thanks for having me on again. I appreciate it. So, we obviously made it through the first surge in the spring. Things kind of died out during the summer to some extent. We had steady COVID cases throughout the summer, but nothing, no large numbers. And we used that time to really try to prepare for what we knew was going to happen in the fall, taking the time to make sure that our supply chain was better established. We had enough PPE for our staff, really continuing education with the staff at the hospital and really trying to make sure that we were maintaining our infection control processes and procedures, despite the numbers going down, making sure that we were all remaining vigilant, while we were in the hospital, while working in the hospital. And then really taking the time to educate the public to realize they needed to come back to get their health care. A lot of people stopped getting health care during the spring, and we really wanted to make sure that people started coming back. We're getting emergency care when they needed it. We're undergoing their preventative health care like colonoscopies, mammograms, other screening tests, getting back to see their PCPs again, and really took the time to sort of get that education out there. Obviously now we're back in another surge again, and kind of dealing with the increased volume that we have in the hospital. The numbers have definitely gone up a lot in the hospital over the last few weeks. But we are...
Sorry, when you talk about another surge, are we looking at similar numbers to what we saw back in April, May timeframe, or is it worse? How does it compare to before, and what's the trajectory look like?
Yeah, I mean, it's a little different than it was in the spring. We're definitely not seeing thankfully, we're definitely not seeing the volume of death that we did see back in the spring. So, if you look at some of the charts that are put out on mass.gov, you can see a big peak of positive COVID cases. But when you look at the same comparable graphs for deaths and hospitalizations, those numbers are not nearly as high as they were in the spring. We're definitely seeing an increase in the number of hospitalizations, and that, tends to go up a couple weeks, 5 to 10 days after positive tests. So we're definitely seeing an increase in that, but the number of deaths so far, thankfully, have not been increasing to that same level. But we are starting to see more and more admitted COVID patients in the hospital, similar to what we saw in the spring. So, during our peak time in the spring, we had upwards of 40 to 45 COVID patients in the hospital. Right now, we're around the mid 20s. So it's not nearly as high, but it definitely is, is definitely creeping up from the summer when we would have 1 to 3, in the hospital at a given time.
And in looking at some of the numbers of DPH, it looked like the age of the people who test positive with COVID is younger now, and we're not seeing the 80 plus year old people with COVID as much. Is that something you're seeing? Do you think that has any impact on the lower number of hospitalizations and the lower death rate, or Is there any
Yeah, I mean,
correlation there?
the testing data is a little interesting. I mean, I think part of the reason we're seeing a little bit of a different demographic is that testing is much more widely available now than it was back in the spring. So that back in the spring, there probably were younger people that had COVID-19, but we weren't testing them because we didn't have the supplies to do that. And we're really limiting testing only to admitted patients in the hospital. And so now that testing is more widely available, we're testing in the school systems, we're testing, through various different activities and things like that. You're finding more positive rates in the younger population. I think, we're definitely seeing COVID in the older population. It feels like it's less than it was back in the spring. And I think a lot of that is due to a lot of the measures that have been put in place. So the nursing homes are better prepared and able to contain COVID-19 within their nursing homes. So we're not seeing a large volume of cases coming out of individual facilities the way we did back in the spring. They have regular testing that's required. They're able to isolate rapidly and prevent the spread within those facilities, which I think has made a big difference as well.
Excellent. And so my understanding is back in the spring, you guys came close to hitting capacity, but you were never, there was never an instance where you were short of ICU beds when they were needed. Are you do you feel like you're in a similar position for this next surge?
Yeah, I mean, we're definitely prepared for increased capacity within the hospital. We've developed new, or in the process of developing new alternative care sites so we can overflow into different areas of the hospital if we need to provide care. We're increasing our staffing in anticipation of volume plus illness. So, we're definitely seeing more illness come through now as well. And so, making sure that we have enough staffing available to care for patients. So, really trying to increase our staffing as well. We've increased our PPE supply so that we know that we have enough supplies, to get us through whatever we need to over the next couple months. And then, at the state level, which I know you're probably going to touch base more on the following week, but, they've created a resurgence process or resurgence planning process so that we work closely within our region 5, to address capacity constraints so that, for example, we're at capacity, but another hospital within our region may be able to take patients. We create a mechanism to be able to provide care, across the region so that patients can go to other hospitals if they need to, should one hospital hit capacity for the volume of patients they can manage.
Excellent. And so some of the other questions I had were as we're coming into, or we just got through Thanksgiving and we're coming into the holiday season. Are there suggestions for the general public and things to tell people to watch out for? What's it important for you to communicate to the residents in Attleboro?
Yeah, I mean, I think as we enter the holiday season, it's going to be a harder season this year. Most of us are used to being able to celebrate with our family and friends, holiday parties, big events, things that have, relatively large gatherings. And that just is not something that's recommended at this time, given, the volume of COVID cases going on. Those kind of gatherings are just going to increase the risk of transmission of COVID throughout the community. So really, we continue to want to recommend what we did over the Thanksgiving season, keep your gatherings to your immediate family as much as possible. What I tell my staff is be creative, use different mechanisms of interacting with the family, Zoom visits, create activities for the kids they can do virtually, drive-by visits. Thankfully, the weather has been relatively good. We'll see how long that lasts.
Sure.
But it did allow for some outdoor events, over the weekend so that you could see people in a more socially distanced manner without the risk of being indoors. And that if you do have to be indoors, limit your gatherings as recommended to less than 10 people, maintain masking while you're inside, and really try to be cautious and maintain all those infectious control procedures as much as possible, because it really is going to be critical to containing COVID-19 over the next month or so to try to really minimize those kind of larger gatherings. But that you can still interact with your family in a way that's safe and still be able to see them over the holiday season.
Okay. And what about if somebody's having an issue, should they stay away from the hospital? Is the hospital safe to go in if they're have something going on or whatever, or should they stay home and just try to ride it out? What's the suggestion for folks?
No, I mean, our messaging remains the same, that if you need healthcare, that's what we're here for. We have, policies, procedures, processes in place within the hospital and in our outpatient practices as well to really maintain safety, try to keep risk of transmission low, between patients. If you're not sure what to do, always call your doctor. They can help direct you to the right place to go. One of the things we are doing is trying to create other avenues where people that are maybe not really sick with COVID-19, but need to be seen, to be able to be seen without having to come to an emergency department. So as an example, our South Attleboro urgent care is our influenza-like illness clinic. So patients that either need to be tested or need to be seen because they've got cough or cold symptoms, but aren't having trouble breathing or chest pain or things that would be more concerning can go to that clinic to be seen without having to come to the emergency department. But that absolutely, if you do have, an issue where you are feeling sick and you need to use the hospital, the emergency services, you should absolutely do that and not feel afraid to do so. We have, we've increased or we've maintained our high level of cleaning within the hospital. We have separate waiting areas for patients with possible COVID versus patients without symptoms of COVID. We have separate areas within the emergency department, similar to what we did back in the spring again, to try to minimize transmission as much as possible. And then we have very strong infection control processes within the hospital. So if you are admitted, you're in a private room, the nurses are using the appropriate PPE and hand washing and all the other infection control measures that are recommended to prevent transmission within the hospital itself.
Excellent. And so, Nurse Joliker, is there anything you want to add? How are things in the emergency room, and what's your perspective?
I think that we're doing fine in the emergency department right now. Our staffing's okay. The patients keep coming in and we're dealing with the volume as they come in. The staff are doing well. And they're prepared. We're prepared for the surge if they're, for increased cases if need be. We're ready.
Excellent. And so the staff is doing well. I know there was a lot of focus back in the spring and in our heroes work here and the parades around the hospital and all of that. And I just want to take a minute and personally say thank you for all the work you guys continue to do. I know the fanfare may have died down, but I know you're still in the thick of it. And I very much appreciate everything you guys are doing there. So thank you.
Thanks. That's great. We appreciate it. The staff appreciate it too. And, it's not their hard work and their commitment to the job and the patients in the community doesn't go unnoticed by, any one of us. And the hospital as a whole has really come together and pulled together during the pandemic. This whole year has been pretty amazing to see.
Excellent. Thank you. So, Dr. Patel or Nurse Joliker, is there anything else you would like to add?
Not that I can think of. I mean, I think to Alyssa's point, the staff continue to work really hard and they will continue to do what they do, which is take really good care of patients as they come into the hospital. It's been a very long 9 or 10 months and, people are getting tired, I think, both in the hospitals and in the community as well. And, really, I can't stress enough the importance of just we got to power through it for the next couple of months and really try to maintain and pay attention to all the safety measures that are being put in place because they're being put in place for a reason. And, we as a community can do our part to try to reduce transmission and reduce the numbers to help be able to provide care for the patients that truly need it. So, really just an appeal to everyone to pay attention throughout the holidays and even after the holidays in terms of all the recommendations for masking and social distancing, good hand hygiene, really trying to do what you can to minimize the transmission.
Perfect. Thank you guys. I appreciate you coming on and I respect that you both are incredibly busy. So we're going to move on. If you feel like dropping off, that's fine. I won't be offended. So thank you so much, guys.
Thank you.
Thank you.
All right. Next up, we have Attleboro Fire Chief LaChance. Chief LaChance, how are you tonight?
I'm doing well. Can you hear me, Todd?
I certainly can.
Okay. Thanks for having me.
Yeah, no, it's good to see you. And how is everything going with the fire department? I know there's been a number of you guys that have been have come down with COVID and whatnot. So can you talk a little bit about that?
Yeah, sure. As you've probably seen in the newspaper or on the news, we're up to 18 firefighters have tested positive now since March. The last
18 out of how many total firefighters do you guys have?
firefighters around 90 approximately.
Okay. Wow.
The number fluctuates a little bit, but I think it's about 90. With dispatches and secretaries, we have around 100 employees. So I have 2 dispatchers also tested positive. So I'm 20 out of 100 employees, which is a pretty high percentage. One of the challenges for us is that the CDC guidelines for what first responders are supposed to do sometimes a little contradictory to the general public. As an example, I was on a conference call with the Department of Public Health several weeks ago, and their definition of a contact is anybody that's been within 6 feet of a person who tests positive within 48 hours for a period of 15 minutes, and that can be cumulative time. And that's with or without a mask. I was very surprised to hear them take that position. Obviously, I have concerns about that because that basically means if one of my paramedics is in the front of an ambulance driving to a call with their partner, both wear a mask, and they do that 4 or 5 times, or 10 times in the shift, and one of them tests positive, they're pretty much a contact. So their guidelines and their recommendations are that at that point, it's up to the local jurisdiction. It would be up to myself, the mayor, the health department, and their requirements and for quarantine for first responders change drastically as well. They're currently suggesting that a first responder who's exposed to a known positive person doesn't need to quarantine for 14 days, that they can continue to work and self-monitor. I personally don't agree with that, so we don't do it. My position is that I would rather be overly cautious as much as we can and keep guys away from work, get them tested when we're able to, and then have them come back to work. So at least we know what we're dealing with. To me, asking guys to come to work that have really had a pretty known exposure and self-monitor, I think that's a bad precedent to set, especially, if you really have no other options, I guess that would be the case, but we have options still. So a lot of my guys don't get to go home. They're working 72 hours straight, probably more than that at times, because when people are sent home, the mission goes on. So the firefighters have all been stepping up, working, ungodly numbers of hours to keep everything in service. And we really haven't had this whole pandemic. We have not had a reduction in service at all. We've been able to keep everything going, which is really a testament to the hard work of all of the firefighters.
Yeah, that was my next question to ask if there had been a reduction in coverage at all. And it's great to hear, and hopefully it continues. But it's tough to hear that folks are working ungodly hours and so much overtime. Definitely appreciate that, and I know the city appreciates it as well.
There's been, they've got a lot of support from the general public. One question we do get a lot of is it with the outbreaks that we've experienced, is it a risk to the community when they go on calls? And something that we've done since day one with the pandemic is early on in the pandemic, when you were dispatching calls, because there was limited PPE, they had us screen the calls for calls that were the highest likelihood to be COVID-19. Nobody's recommending that anymore. We assume that every call we go on is COVID-19. So the paramedics and EMTs are wearing full PPE, which is N95 masks, the highest level of masks, goggles, surgical gowns, everything conceivably when they're going on these calls. That's to protect them, because we don't know if the patients have anything. And it's also to protect the patients. The biggest challenge for us is we can't assume when we go into a house just because there's no known positive patient there. As you know, Todd, there's so many people that are positive that have absolutely no idea and haven't been tested. So we go into every house and every contact and assume that person's positive.
Interesting. And then the other question I had, we don't have to go into a lot of the details, but there in the newspaper, there's been a lot of talk about IOD and whatnot. Can you just briefly summarize what's going on there?
Yeah, I can. So
what IOD means?
Sure. IOD means injured on duty. So if a firefighter, breaks a leg at a fire, there's mass general law that the firefighter is covered as an injured on duty case, which means all of those medical bills associated with that care are the city's responsibility. So it's different than them using their own private health insurance. It's the city's responsibility. This is a state law. It also means that their pay is tax-free during the time that they're out incapacitated for something that was work-related. So that's a state law. There's contractual language that some places have. Attleboro is one that has some language in it that makes things like heart disease and cancer considered presumptive injuries for the job. It's been around. Attleboro has had that language for at least 20 to 25 years. And what the controversy is right now between the union and the city administration is whether COVID-19 falls under that contractual language. That's something that's, both parties are involved with doing what they need to do to present their cases on that. My opinion, I'll say it publicly just because the mayor said it publicly. And I give him a lot of credit for that. He had said publicly last week on a news station that I don't agree with him on that. So I don't. However, I want to make it clear that some of the stuff that's been circulated isn't completely accurate either.
Sure.
No firefighters are using any sick leave. Okay. So any firefighter that's out on COVID-19, whether they're positive or not, if I send somebody home, which we've done quite a few, I can't even honestly don't even number anymore, but I would have to say 40 to 50 firefighters have been told to go home and don't come back to work either for 2 weeks or until they get a negative COVID-19 test. Not one of them has used their own sick leave. So they're not required to use sick leave. And that's something that we've been doing since the beginning. So it's important that, when people formulate their opinions, that they're based on the actual fact,
Sure. Yep.
So 17 firefighters have been covered. Basically, I've been able to demonstrate to the mayor, some kind of causation, something that is a indication that he's comfortable with, that they contracted it, more than likely than not from work. There's still that one case that we haven't been able to. My only concern with that is, like I said earlier, he could certainly go into a house with somebody who is positive that we don't know. That's really the unknown with all of this. They go to fires. There's other things that we do. One of the problems that we had early on with some of the guidelines that the CDC was requiring, and even when we talked to some of the different physicians, is that they sometimes forget that the first responders are not just paramedics, they're not just medical people. They do other parts of the job. That the reality is that wearing a mask isn't the most effective thing all the time. And we carry people up and down stairs. Hospitals don't do that. You're carrying people, you're bending over. If you're at fires, you're using your SCBA. There's a period of time where you can't wear a mask because you're going to put on your Scott Air, your SCBA equipment. So you're going to be exposed. And it's a very physically demanding event. So if you look at even professional sports, with all the precautions they're taking when the athletes are actually out on the field, they're not wearing masks. Can't really ask firefighters to wear surgical masks at fires. First, they're flammable, so it's not really a great idea.
Sure. Yep.
And second, it's just not great when you're using that much cardiovascular output to do it. So, there's things that make the job complicated to have 100%, protection at all times. And the firefighters know that. That's why there's presumptive language for certain things, like cancer and heart disease, to give them the protection so that they can go in and do what they need to do. But just be clear that not one firefighter has used 1 day of sick leave for COVID-19.
Okay. No, and I appreciate it, and appreciate everything that you guys have done through this. In a similar manner that, the fanfare has died down a little bit for medical workers. But I respect that you guys are still on the front lines of this and dealing with it every day. So thank you, and appreciate everything the entire fire department is doing. So
thank you, Todd. If I could just add something too, because I do get asked a bit. One thing that I think is drastically different now than in March, that I think complicates it for everybody, but especially for the first responders. Early on, when the pandemic first started and everything was shut down, really our major concern for first responders was catching COVID-19 on a call, and bringing it home. Now that everything's open, And the way that the transmission is so complicated, and it's kind of sometimes hard to follow, now there's two parts of it. You're still worried about catching it on a call, but you're equally as concerned about catching it outside or at home, or if I go to a restaurant and I come back to work and unknowingly bring it into the department. One of the problems that we've seen with the that I've seen internally with the department that it's kind of interesting is that the people that have been the sickest on the department from their exposure, and this is just from my own internal research, but this is what we've seen, is it really does seem like the firefighters that are in close proximity for extended period of time are the ones that have caught it from each other. We've had at the outlying stations like Twin Village and Briggs Corner. Briggs Corner is a three firefighter station, and it's tiny little living space. Shared sleeping quarters, shared bathroom. Everything's really small. I've actually had firefighters that were on a 24-hour shift there, 3 of them together for a 24-hour shift. One of them tested positive, so obviously the other 2 we tested. And the second tested positive and the third was negative, so it's almost like defies logic when you sit and look at that going, how could that person be negative when the other 2 are positive? It's basically like living in the same house, but there are enough cases. I've had firefighters that test positive and their spouses didn't test positive, so I think there's as much that we still don't know about it as there is that we do know. And what I try to encourage everybody to do, especially my firefighters, is that don't think that we can do anything to prevent it, because I don't think that that's a wise message to send. Like in the fire prevention world, we don't plan on preventing fires 100%. We're about risk reduction. So I think we should really look at it that everything that you can do, maybe wear a mask doesn't stop at 100%. Maybe it's 50%, maybe it's 30%. Keeping 6 to 10 feet of space, maybe that adds another 10 to 20%. When you start to do all of those things and hand washing and all of the other stuff, it definitely does seem like we have some ability to control it in the more controlled environments. Kids are playing youth sports. The schools are doing a really good job stopping transmission in the schools. So hopefully we can continue this trend. And, another thing that's just become brought to our attention is that we're at least in the initial stages of looking for the vaccination for the first responders. So we've already started polling the department to see, who's interested in the vaccination and what that will entail. But, we're told there's a possibility the middle of December, which I think is that'll probably have a pretty significant impact on what we do going forward.
Oh, that's great news. Yeah. And I love that analogy about, risk mitigation and the combination of all the different steps together really do work as best I can. It just is the combination of everything, the layered approach really does reduce the risk. So again, I appreciate everything you do. Anything else?
Just want to give a major shout out to the firefighters, because I'm quite certain that a lot of them didn't go home. They worked their shift on Thanksgiving and they get to go home Friday to their families, because we were, guys were out, and to be safe. Guys were home, quarantining. So there were guys that had to step up, and guys and girls had to step up and, take on extra shifts. And, they've done a tremendous job doing that. I know that they're tired and stressed like everybody else. And I just wanted to make it clear that I'm grateful for the support and the hard work of all of the members of the fire department.
Outstanding. Thank you, Chief LaChance.
Thanks, Todd. Have a good night.
You too.
Take care.
Next up, we have Superintendent Dave Sawyer. Dave, how are you? I understand there's some news that came out yesterday. Do you want to start with that?
Yeah, thank you for having me. It was a busy weekend, even though it was supposedly a holiday weekend. We let the families at Brennan Middle School know yesterday that we need to switch to remote instruction for Monday and Tuesday. There's the possibility it might last longer, but we're hopeful that by Wednesday we'll be able to tell families that we're on for Thursday and Friday. We'll have to see how things play out. This was entirely because of staffing problems. We did not have an outbreak or any in-school transmission at Brennan. It's just simply that we have too many staff members who either have tested positive or are quarantined because they are a close contact. Some of those close contacts are due to exposure from a positive case in school, and others are close contacts because of exposure in other parts of their lives. So it's a complicated situation, keeping the schools running. We don't have as many subs as we normally do. Not to digress, but Attleboro, struggles with the number of subs we have in a good year. So it's not that surprising that under these conditions, we're having a really hard time finding people who are willing to come in and do that work with us. So there's only so many people who can be out of the building before we just can't cover all of those absences, and the situation becomes untenable. So that's what that is about.
So that's great to hear that this wasn't the result of an outbreak per se at Brennan, and that's it. I think it's important to make that distinction. But speaking of which, do you have numbers on what it's looked like across the school system for outbreaks, and are there trends that you're seeing at all? How is that looking?
We've kept out of school almost 700 people since the start of school. That's about 10% of our population when you factor both students and staff in. So that's either because they were a positive case, but much more often it's the case that you're a close contact. So that's 700 different incidents since September 14th, where we've had to tell someone that they couldn't either come to work or school because of their exposure to COVID.
And when they're kept out in quarantine like that, for how long is that period?
Well, it's 14 days for a close contact. It's 10 days from when you test positive.
Okay.
And, depending on exposure, I mean, sometimes by the time we figure out that someone needs to be quarantined, they're only out a couple of days because they may have been home not feeling well to begin with. And it's every situation is a little bit different, as we've learned, but at maximum, it's 14 days. So, that's 700 people who have been affected. Of those 700, we've had 72 positive cases. So that's 72 different times that somebody was in the schools, either because they work there or because they go to school there. And within 48 hours of being there, they test positive or had symptoms within 48 hours and tested positive later than 48 hours. So, of those 72 cases, that's 59 students and 13 staff members. All 72 of those people were exposed to the virus outside of the schools and got sick and then came to school before they realized they were sick. So that's been the trend as of now.
Okay. And with contact tracing, have you seen is there a lot of spread for those 72 cases that bring it into the school? Has there been spread, or have the protocols been working?
So
they've been working, but
so we've had 0 cases of in-school transmission up to this date. Now,
great.
As the virus has continued to grow and community spread is continued here in Attleboro, I say that less and less confidently. Sure. Because I fear that the moment in which I don't get to say that anymore is approaching. But up to this point, we can say pretty confidently that we've had 0. And there've been a couple cases that we've had to have the health department get involved to make sure that our perception was correct. There's some pretty good guidance from CDC on when we should do that. And we're very lucky to have a wonderful health department here in Attleboro who's a great partner with the schools. So, when we get them involved, we turn it over to the experts, they make the decision. And luckily, so far, they've done their investigation and decided, nope, these cases were not due to in-school transmission. Now, we see an increasing number of cases where the source of the exposure is unknown. So, one could argue that if it's unknown, then they could have caught it from someone who was asymptomatic at school. But the point in their determination is that, that's true, but it's also true that they could have caught it asymptomatically outside of the school. So if you can't trace it back to exposure to a known case, no one knows where you got it. And we see an increasing number of that in the cases that we're dealing with. As the numbers have really picked up in Attleboro, we have more and more unknown cases because there's more and more community spread, more and more people who are catching the virus from places that they're not quite sure where that is. But that all said, I think the most important trend that we've noticed is that most of the cases, at least among the kids and the staff members that that we're aware of, it's been through household transmission. And I think that goes back to what Chief LaChance was saying, that anecdotally from a guy who's watching the data every day and dealing with these cases, it seems like being inside together with your masks off in close proximity is what leads to transmission.
Of course.
And of course, that most often happens these days in homes, right? So when we see one case, we quarantine the whole family. Within a week, they all test positive, or 3 out of 4 test positive. That's a very, very, very common trend that we're seeing.
And what about, so the questions I get a lot are, are we going to move to full remote from the hybrid model? And if so, what's the criteria? Now, it's great to hear that the Brennan situation was a staffing situation more than an outbreak. But can you talk a little bit about that?
Yeah, so the state has changed its direction. It had, original guidance back in August that was very, very cautious because at that time, no one really knew, how school was going to play out. There wasn't a lot of data to draw from, and there was a lot of open questions. And, a lot of people, really questioned whether or not we should be doing school at all. So it was in that mode where we didn't really have good information that the state took a pretty cautious approach. And as the data has come in, and it very strongly suggests that schools are safe, they have changed their guidance. So the idea of being fully remote is pretty much off the table as like a permanent condition for a district to be in. They're no longer supporting that as a condition that they think is in kids' best interest. They want kids in school as much as possible, as do we. But of course, we all want them to be safe. So how do they define that now? They now have 2 measures that we have to keep an eye on. One is the average daily cases per 100,000. They changed that from 8 to 10, so they gave themselves a little bit more wiggle room. We blew past 10 quite a while ago. We've been operating well above 10, as you well know. So we certainly meet that criteria. So you have to have that, plus you have to have a positivity rate. And for Attleboro, our positivity rate has to be above 5, which it is. For a larger city, it has to be, you go to a to red at 4%. And I think that reflects that, the larger communities, the percentages play a little bit different in terms of how one number can skew the rate. So we have above 5% positivity. So those 2 factors put us in the red. And as a red community, that means that we are suggested to be in hybrid. So it used to be that red meant remote. Now red means hybrid, and everything else they're pushing for people to be fully in person. So, when do you go remote then? It's only when you're red and you have evidence of in-school transmission. And when you have in-school transmission, that doesn't mean you go remote permanently. That just means you go remote temporarily to investigate the situation, understand what broke down, and to establish what they call mitigation strategies to ensure that doesn't happen again. So as long as we can continue to operate and not see an outbreak or multiple cases of in-school transmission, the expectation from the state is that we stay in a hybrid model and just go remote as needed, which is we're doing at Brennan this week.
Got it. No, that's good. It's good to understand how all of that works. So now, based on that, if we were to come out of the red, is there talk or a potential of going full in person this
we're supposed to do as much as possible. In the guidance, there's a pretty important caveat, which is if feasible. And you have to follow all the guidance to be able to deliver full in-person instruction. And based on the experience that we've had thus far, now that we've see how the buildings operate, we can see what the rooms really look like with the kids in them at distance. We're very confident that we cannot do full in-person while meeting the guidance as it currently is. So the state
Okay.
would have to change the school guidance for us to be operating fully in person. And there's a couple factors that lead to that conclusion. One, we would not be able to do busing. So under the guidance, we only can run the buses at 1/3 capacity. So even if we did a completely different schedule and did double runs as a district, that only gets you to 2/3 of the amount of bus runs we need to do. So transportation's a huge problem. Lunches, we do not have the space. So when kids eat lunch, they have to take their masks off. And so you have to have them at significant distance because they're doing that for more than 15 minutes. And we don't have the space to operate lunches at that kind of distance. And then finally, while there are classrooms in the district with the number of kids who are in that class, if we brought them all back, we probably could space them out and be at 3 feet. We'd have to give up on 6 feet. We've done as much of the district at 6 feet as we possibly can. We do have some rooms that are at less than 6 feet, but we've pushed for 6 as much as possible. We'd have to give up on 6. We'd have to go down to 3, and even at 3 feet, there are many grades in certain schools that you couldn't, even at 3 feet, bring everybody back into the school.
Okay.
So as long as distancing seems to be a part of the success, it's not feasible for us to come back in person. And I have to tell you, I've been a loud voice in expressing that the data says that what we're doing works. With all of the cases that we're experiencing in Attleboro and have throughout the fall, and with the entire increase, you haven't seen any in-school transmission yet. So with the virus spreading rapidly within the community, it's not happening at school. So why is school such a great place? Well, it's because of the protocols, right? Everyone's masked, everyone's at distance. We're washing hands. We're taking all the necessary steps to make sure that even when people come in who are sick, they're not spreading the disease to anybody else. And so when people get mad that we say, listen, under this guidance, we can't do it fully in person. The reason we're saying that is because we'd have to give up on the guidance that's kept us safe. And, if we do that and we start seeing an outbreak in the school, then the schools end up closed, which works against our desire to have the schools open. So if we really want kids to be back as much as possible, while we're in these conditions, we're going to have to keep it at the hybrid.
That makes perfect sense. And so my last question is just regarding learning. How are the kids doing with the hybrid model and working remote? I know for my kids, I've been impressed with the difference with this new school year as compared to the end of last year when so we had to, I don't want to say it was ad hoc, but we had to scramble to make the change. I've personally been impressed with the way it's worked out for my kids, but is there any data yet? I know it's still early, but what are you seeing? Yeah,
I mean, honestly, the only data that's really available at this point is attendance, which we've talked about at school committee as being a significant concern for us. We do have a segment of the population who don't feel safe coming to school yet, who see that, how many people have been quarantined as a sign that schools aren't safe, rather than, I would think is the way to look at it is it's proof of that we're doing all the things we need to do to keep people safe.
Right.
But, some people don't buy into that way of looking at it and are keeping their kids home. So that's one data point that suggests that we're having problems. But, to answer the larger question, as is the case in any time, right? There's a great variety amongst our students in terms of what works for them, what suits them, what's a good fit for their success. It's one of the things that we struggle with as a school district. We've inherited this factory model approach to education, which we are trying to reform because every student deserves an education that's fit for what makes most sense for them individually. And that's a tough thing to pull off, and that's a long-term goal for us. But it's because of that some people are somewhat surprised by, in this year, some students are actually thriving. Some kids just really, really love the way that school is different and are finding that they are more successful. But other students, and I would say there are probably more of these, are struggling with some of the challenges that they face. I hear that Owen is not too unlike someone who lives at my house, Mikey. Not very good at necessarily passing everything in that's being done.
I'll make sure to let him know that you've seen that. Yeah. No, we have one of each here. Yeah.
He's in good company. I'm here to tell you. It's a real problem for some kids to keep up with the fact that they're in and out, right? And some kids are struggling with the remote part of it, without somebody standing in front of them, and requiring them to do it. Some kids just don't do it. They can't bring themselves to do what no one's forcing them to. At least under normal circumstances, we have the kids at school, they're captives, right? Like you can get them to do stuff just by the fact that what else are they going to do? So there are situations where I think that there's a struggle. And plus, these are stressful times. So some kids, it's not so much the academics that are the problem. It's the stress that I think their family members are experiencing, that their teachers are experiencing, that we're all experiencing. So some kids are very sensitive to that and are finding this, emotionally very difficult. Forget just the challenge of trying to do school in a different way. And I got to tell you,
how are the teachers doing?
Yeah, the teachers deserve a lot of credit. This is very, very hard. None of them were trained to operate this way, right? We are absolutely making this up as we go. And we're very lucky to have such a dedicated staff that are doing their level-headed best to meet the needs of kids and to work their way through all the challenges that we're facing. It's really hard to plan one lesson for the kids that are in front of you and then have a whole nother group of kids that you don't see who are operating at home. And so you got two different sets of work that you got to deal with. And remember which day was which kid supposed to be here. And I think it's very understandable that they are completely overwhelmed by the challenges that the situation, the situation that they face. But that said, there are opportunities in the way we're doing things that I think a lot of them are starting to really embrace. By going in a hybrid mode, you have half the kids at home working on asynchronous assignments through Google Classroom. So, that's work. And, while it's very different to do that all at once at home by yourself, if you think about what a school day is like, a lot of time in school is independently working at your desk on something that the teacher just explained to the whole class you need to do, right? So you take all those moments and put them together and you send that at home on the cohort day that they're remote. But then as a result, on the cohort day that they're in person with the teacher, you now have class sizes like we could only dream of in the past.
Okay.
And in that environment, there's real opportunity for teacher attention. And one of the things that we believe is that teacher attention is the most valuable resource we have as a district. So, it is very hard for a teacher with 28 kids in a class every day to really make sure they're getting to everyone. But now that we're seeing class sizes of in some places it's as low, it's under at 10, in a lot of places it's closer to 12 on any given day. But at that rate, you can really make time for each student and make sure that you can address their needs. And where people are adjusting their routines to maximize that opportunity, I think we're seeing some real success.
That's great. That was all I had. Did anybody else have questions for Superintendent Dave Sawyer?
Todd, it's Jay. I don't have a question. I just wanted to say, Dave, thank you for your phenomenal leadership throughout this whole process. I think that I have someone in my house who would be on the list that you and Todd were talking about. It really has been. It's been, I think some of the life lessons that these kids are learning is going to set them up for when they make it into the workforce, when they make it to college. I think there's some real positives coming out of it, but thank you for your leadership.
Thank you very much. The teachers deserve all the credit.
All right. And yeah, like I said before, I understand you're incredibly busy. Thank you so much for joining us. And if you need to jump off, certainly feel free. I won't be offended.
Thank you for having me.
Thank you. Next up, we have State Senator Paul Feeney. Always a pleasure, Paul.
Councilor Kovas, great to see you again, my friend. It's unfortunate that we're back in this position. I know when we put these on pause, what was it, back in July or August?
In June.
Was it June? Wow. we were hoping that we wouldn't have to get to this point again. Obviously, we were preparing for the worst and figured there would be a second surge, but we had some hope. We had some hope. We were at an all-time low on our cases, and mitigation efforts were going strong. We were starting to reopen some certain segments of the economy, but here we are again. And I don't think it was unexpected. Obviously, we met Todd for months with some of the best experts in the community and across the state on these forums, and they all told us that we were likely going to see a resurgence of this in the fall, and that's certainly what we're seeing. So I want to just start off first of all by saying thank you to Chief LaChance for all the work that him and his firefighters are doing for our community in Attleboro. They are up against it. They have dealt with some extremely difficult circumstances and challenges with many of their firefighters becoming COVID positive. And then even the ones that don't, like he said, many times you have to be as careful as possible. And if you have somebody that was, riding in a truck or an engine or an ambulance with somebody who was positive or around somebody that was positive, you got to quarantine them as well. So I know a lot of those firefighters have been working extremely long hours. And I want to thank the chief for his leadership, and of course all the firefighters for the work that they're doing. Superintendent Sawyer, my God, if there was anything that got thrown into the most extreme amount of turmoil in the state when we started dealing with this in the spring, it was the schools. I mean, there was no playbook for this, right? And essentially we were all trying to build the plane as we were flying it, and the schools did an incredible job really in adapting and trying to triage some of the issues that they needed to deal with immediately to keep kids safe. But then to understand that, their mission is long-term, and it's to educate children. And so for the educators out there, and especially the parents, I mean, I couldn't even fathom what you're going through, Councilor Kovas and Councilor Delicio and parents across Attleboro, and trying to make sure that kids are getting as much as they can out of their education. So well done by everybody that's involved in the school system as well. Todd, I just want to, quickly kind of hit on where we are. I think it's important to frame it.
I think that's great.
Important to frame it. We did that every single week back in the spring, taking a look at kind of the wonky raw data and then some of the indicators. Right now across the Commonwealth, I think as of today, we're at about 2,501 new cases. When we look at daily cases, sometimes that doesn't tell all the picture. So we want to look at really a 7-day average of positivity of the test rate. We understand that testing goes up and down based on all sorts of different factors, which I'm going to talk about in a second. But the 7-day average right now for positivity is about 3.8%. That's as of today. Estimated
When
active.
you say positivity, what's that mean?
Yeah, so positive test cases. So if you have 100 people that go and get a test, we're seeing about 3.8 of them, roughly, close to 4 of them are actually
Test positive.
testing positive.
Got it.
And that tells us a picture, right? Because the raw number of positive cases, that's going to fluctuate with testing, right? We saw back in March when we started talking about this, we really didn't have a robust testing system. As Dr. Patel from Sturdy said earlier, we were doing a lot of testing just for people that were presenting with symptoms, just folks that were actually showing up, in an emergency department in a hospital, because we lacked that kind of widespread testing. Well, that exists now. And it exists not only widespread testing for people, anybody that wants to get a test can get a test, but in some places like in higher education where they're doing so-called cadence testing, which is kind of daily surveillance testing every few days. And just, even if you're not presenting with symptoms, even if you haven't been around somebody positive, just to get an idea of, kind of where we are in certain, in certain facilities, in certain schools, in certain places. And that's important, obviously, with higher education and with congregate care facilities like nursing homes and places like that. The largest age group of total cases in the previous 2-week period, and this is something, Todd, that you mentioned earlier with Dr. Patel and Nurse Joliker, was 20 to 29 years old, followed by those in the 30 to 39-year-old age category. Now, we don't know why, right? And certainly I'm a layman at this. I'm a state senator. I'm not an epidemiologist or an expert in the field. But in my conversations with folks, there's a couple of factors I think that we're seeing. Number one, obviously, as Dr. Patel mentioned earlier, there's more widespread testing. So it's very possible that even in the spring, there were a lot more young people that were positive with COVID-19, but we just didn't know it because they weren't getting tested. Now it's more widespread. We're seeing it. But the second thing is, I think that as we go through this kind of mitigation fatigue, which you'll hear a lot of people talk about across the country, where folks are just kind of sick and tired of the mitigation aspect of this, of staying away from friends and family, of staying out of big groups, of wearing a mask, of conducting good hand hygiene and the like. We're starting to see young people, I think, become more exposed to that. And I think with the start of school, not saying, as Superintendent Sawyer said, not saying that the spread happens in school, but there are just more gatherings, there's more get-togethers, there's more after-school activities. We're starting to see kids play more sports. So we're getting a little bit worried about kind of the younger demographic of people that are testing positive on this. It's an alarming figure. Luckily, they handle it better than folks in the older age groups. Sometimes, if there's other comorbidities or other factors, then they don't handle it as well. So we're going to keep an eye on that. And the average age of cases that were hospitalized due to COVID is 65. So again, we know that older folks don't handle it as well, and folks that are immunocompromised, folks that have other respiratory illnesses. But 65 is a lower number than what we started talking about back in March, when we were seeing people in the 80s that were going to the hospital. So keeping an eye on that. Now, just to kind of wrap that up and with the bow and take that raw number and then talk a little bit about indicators across the state. We look at 7-day averages to get a trend line. And we look at, like I said, positive test rate and how that compares to kind of where we were. Back in the spring, we overused the term, but it was so important. We had to flatten the curve. Remember, that was our goal.
Oh, yeah. Yep.
Right? To flatten the curve, hashtag flatten the curve. It'll probably be the phrase of 2020. But when we started talking about that, that was a real thing, right? We didn't want to overwhelm the hospitals. We didn't want to overwhelm the capacity that we had at Sturdy Community Hospital or at some of the Boston hospitals. So really the point of kind of the aggressive mitigation techniques were to flatten that curve so that we didn't have this surge of people to hospitals where, we just didn't have the ability to treat people, and you started to ration out, things like ventilators. That was a very real possibility, and it remains a possibility. So it's something that, as policymakers, when we deal with our, folks in the administration and the public health sector, we want to make sure that we're giving them the resources and applying the right mitigation techniques so that we don't get to that point. That's obviously number one. So we did, somewhat okay in flattening the curve. Massachusetts was certainly challenged in the spring with a lot of cases, but we're starting to see that number tick back up again. And if you look at the charts, you look at the graphs, we're certainly starting to see that again. And I think we're seeing an increase to the point where the governor announced, just last week that we're going to be opening field hospitals again to be able to deal with an additional surge. We're certainly, as we do the daily census of the hospitals across the Commonwealth, making sure that they have a surge capacity plan, and that we're really, have an understanding regionally. One of the things that was, we look at statewide numbers, that really doesn't mean much if you're in a healthcare desert or a portion of the state where you're either at capacity or you're at surge capacity, and if you're sick, there's nowhere to go. So there's this kind of give and take and understanding that different regions are being impacted, different communities are being impacted differently. And we need to make sure that there's really a holistic view of where the capacity lies in our hospitals. So when we look at some of those indicators that are very important for us to consider, we look at the test rate, obviously, which is, like I said, 3.8% of positive testing. Just to put that into perspective, the percent of change since the lowest observed value. So back when we said, all right, we don't need to do these Attleboro community forums anymore, that is up 390%. The lowest observed value back then was about 0.8% positive test rate. So just to put it into perspective, from 0.8% up 390% to 3.8% today. That's significant. 7-day average of new confirmed cases right now is around 1,700. This has gone down in the last few days a little bit. But as I mentioned earlier, I think there's kind of one factor to that, and that is it's been the holidays and there's probably not as many people going to get tested. But that's up over 990% from the lowest observed value, which was 157 back when we stopped these forums. So again, another significant one. And then ICU capacity today across the Commonwealth is at about 50%, according to today's hospital census. So we're in that, in a place now where, we're starting to see the trends going up. Obviously, over the last few weeks, it's gone up significantly. But we're also in a place, Todd, where I have hope because we've been through this before. We know what we had to do in the spring. We have a playbook now. There are certain things that we know now that we didn't know back in the spring that we can do differently. We can run more efficiently. So as a state, we're really looking at, making sure that we have the resources available, the PPE available, making sure that we have staffing available, and making sure that we're telling everybody how important it is to adhere to these, orders and mitigation techniques. Wearing a mask, wearing a face covering, absolute must. Hand hygiene, we learned this back in preschool. It's more important today than ever, making sure that we're using sanitizer or washing our hands with soap and water. And the big thing, obviously, is staying home as much as possible, not intermingling among different groups, not getting together in big groups and exposing ourselves for long periods of time to people that may be asymptomatic but are still shedding the virus. Mm-hmm. So that's kind of where we're at today. It's an unfortunate situation, but like I said, I have some hope because, I believe, we do have the ability to be able to mitigate this and get through this over the next couple of months, which could be a challenge.
Would you say the strategy has changed a little bit since we were doing the whole flatten the curve thing to sort of prevent us from overwhelming ICUs to, I feel like now the vaccine's right on the horizon and we just need to stretch it out a little bit to move as many of those cases to the right of when we get the vaccine as possible?
Yeah, I think it's a little bit of both. I think we still need to make sure that we're flattening the curve because, at 50% ICU capacity and with roughly 35% bed capacity elsewhere, non-ICU beds, we're close to a surge. So we certainly have to flatten the curve. I think the light at the end of the tunnel is that we are getting some positive news from some of the vaccine makers. The research and development that went into it, especially here locally in Massachusetts, is amazing.
Absolutely.
The work that they've done here in the Commonwealth to get us to a place where they have we're on the doorstep of a vaccine delivery, I think is a positive sign. But it's important to note too, I've had a lot of people reach out to me about the vaccine, and I had a recent conversation with the chief of infectious diseases over at Mass General, and she was very clear and sober about it and said, look, when we talk about, not only getting this vaccine manufactured, but the logistics involved in getting it out to every state, get distribution, and it looks like it's going to be you're going to have to get 2 inoculations in each course of the vaccination, depending on which one, gets distributed widely, which means now you're going to have to make sure that people are in compliance, that you get in both shots. Massachusetts developed a plan that got sent down to DC, to talk about who gets it first, and first responders and healthcare workers. And, there's this question about students and what's mandatory, what's not mandatory. And those are conversations that we're going to have over the next few months. But realistically, by the time we get to a place where, the majority of people in Massachusetts or across the country are vaccinated, you're talking it's at least a year away. So though the vaccine is a positive sign, we're not going to get to that, I'm sure everybody's heard the term herd immunity. We're not going to get to that herd immunity for a long time. So continuing to do what we do, but, the strategy around waiting for a vaccine, I think we need to, it's going to be a positive sign when it does come out, but we're not going to be, at a place where we can rely on that for at least another year.
Excellent. These are unfortunate circumstances to see you, but it's always a pleasure to see you and always reassuring to hear you speak. So thank you.
Thank you, Council. I appreciate it. I just want to thank everybody again. And, since we met before, Representative Hawkins has a full grown beard. So he's been, we've been working hard kind of in the cave, trying to figure things out. And I just want to, again, thank you. And I know earlier we talked a little bit with Chief LaChance about, firefighters and injured on duty status. And there's been, discussions in Attleboro ongoing about that. I just want to let you know, Todd, and everybody who's watching this, we had filed some legislation back in early spring because we, quite candidly saw this as being a potential problem going forward with first responders. We filed language on presumption. So basically, there were 2 bills filed, one in the House, one in the Senate, that would add COVID-19 to the list of presumption diseases, like the chief spoke about earlier, heart disease, cancer. Just basically saying that if a firefighter or a police officer or a public worker in the course of their duty becomes ill from COVID-19, that the presumption is that they caught it at work. And, obviously that triggers a couple of things. But you're essentially just shifting the burden of proof. And it's simple in my mind. And the reason why I've supported it since day one and co-sponsored the legislation and continue to push for it is because if you have, firefighters that we're putting in harm's way, or police officers that are doing this work every day that we're putting in harm's way, and we know the hours that they're working, it's common sense would say that they're exposed more than the rest of us. Certainly as a state senator who's doing most of my meetings remote, and I'm not exposed to COVID-19 like they are, the presumption is that they actually would catch this on the job. That is, both of those bills are sitting in Ways and Means of the respective chambers right now. So the House bills in House Ways and Means, Senate bills in Senate Ways and Means. Myself and Representative Hawkins have been kind of strategizing together with some of our colleagues about how we can move that legislation before the end of our legislative session in the first week of January. But I just want to make sure that the public understands that there is legislation out there pending that statewide would put COVID-19 as a presumption for first responders and nurses. I filed language for nurses, bedside nurses as well. So we want to make sure that people know that, and if they can reach out, obviously in Attleboro, that myself and Representative Hawkins and some of our other colleagues in the delegation are supportive, but it's important to get those bills moving because I think it'll make a world of difference, especially for our first responders. So thanks, Todd. It was great to see you all again.
Thank you. Next up, we have Representative Hawkins. Jim, how are we doing?
So I've been thinking this whole time, thank you to you and Jim Jones, the 2 people who make this happen. I think there's been a whole lot of people in the community, and I just sense this going around and listening to people that are really starting to get anxious about this rapid rise in COVID and how it's going and what's going to happen. And the one thing that is an answer is for people to talk to all of us, from Senator Feeney to you and Councilor DeSimone, Councilor Delissio, all of you to be here, to be available, so you know that we're still alive and still doing stuff about this. Quite a job for you to put this together in a couple of days. And Jim Jones, I don't think he ever says no. He's just always does this stuff. I don't know if he ever sleeps, but thank you so much for doing this. I want to make sure we get to Councilor Delissio, because I know he wants to talk about the food drive that all of us are working on. So a couple of quick things that are going on, that recent anyway. MBTA is announced service cuts. And geez, if you go to the parking lot at the MBTA station, you'll know why. There's nobody using it, so they've got to do that. I think they have, I've had extensive conversations with them. They have really good data about ridership. They have really good data about economic growth, particularly in Attleboro. They're aware of that. But what they don't know is what's happening, how individual people, if you were to shift from 7 to 7 or something like that, that's the part they don't know. So if you do use the train now, or you're counting on it to be using it soon, you should submit that in testimony. It's mbta.com/forging ahead. And you can submit, there's a link in there, you can submit testimony. And I would urge you to do that, even if you're not using it right now, if that's a concern. I think the other thing that happens a lot in both my office and Senator Feeney's is people who are struggling with unemployment. And I think the incidence of fraud has been a problem. And what we're realizing now, if you're collecting unemployment and you're already collecting unemployment legitimately, and somebody uses your name, your account gets frozen as well as the fake one, which is causing some real trouble for people. Fortunately, not the same volume of people with unemployment that we had in the spring and summer, but still a lot of people who are really tied up by this. If this has happened, it's a problem, and you're welcome to contact either my office or Senator Feeney's, and we can file a formal request for you. But mostly, I want to let Councilor Delissio talk, because we're one of the things that's happened in Attleboro is to do with homeless people, and not just homeless people, but people who are suffering from food insecurity. So I'll cede the rest of my time to him, because I know that we've gone past our 8 o'clock.
Sure. But I do think it's important to talk for a second about the unemployment fraud. I
Yes.
believe there's a website people can go to.
Yes,
if there
yes.
has
You have to file a report, and that would be on, if you go to mass.gov, in the upper corner, there's a yellow box that says COVID, and you scroll down, you're going to find unemployment, and there'll be a link for where you would file a report on that. And I've been hacked twice, so it's like all over the place. You don't have to. You might file a police. I didn't file a police report, but you could do both of those if you wanted to. But definitely file a report with them.
Perfect. Thank you so much, Jim. It's always a pleasure. And so, based on that, I guess you introduced Councilor Delissio, so we'll move on to him, and he can talk about the food drive briefly, and then we'll finish up with Councilor DeSimone.
Sure. Thank you. So Todd, thank you for putting this together. Jim Jones, thank you for all that you do, not just with this, but with the council meetings and all the other meetings as well. So this has been a great forum, Zoom, for people to communicate throughout this pandemic. So as Rep. Hawkins talked about, we will be doing another drive-through food drive. This one will be a home for the holidays food drive. The economy's open in certain sectors, but unfortunately, there are still a lot of our neighbors and friends and even family who are dealing with job loss. Food security has become such a big issue in this whole pandemic, and it's something that Councilor Kovas, Rep. Hawkins, Senator Feeney, myself, and former Councilor Heather Parika, we've really put a lot of time and effort into ensuring people knew that there's someone looking out for them. And there's a lot of people who are in situations they never thought they'd find themselves in. So we started the first one in April, we did one in May and June, and then throughout the summer at the farmers market. And we'd be remiss if we didn't mention the great work of the Attleboro Police Association for their co-sponsoring several of the drives throughout the summer at the Attleboro Farmers Market. We're looking to finalize all the details, but we are looking at either 12/12 or 12/19. I should have these details just hammered out with the Hebron Food Pantry early this week, and then we'll be taught if I could get some time next weekend to talk a little bit next Sunday night, talk a little bit about this once we have everything finalized. Again, we'll be supporting Hebron Food Pantry, St. Joseph's Food Cellar, St. Teresa's. We're always looking for things like boxed pasta, pasta sauce, canned pasta, soups, vegetables, cereals, lunchbox snacks. And it's really key that they're not expired. And a lot of time we do get expired food. And then just personal hygiene items, they go a long way. Especially toilet paper and paper towels, things of that nature. Also, cash donations are accepted, and a lot of times people just want to help by writing a check or giving us cash, and that's really important because for every $1 that gets us $20 of buying power at the Greater Boston Food Bank. So I just want to say again in closing, really, that for those that are in need of help, ask. You've got a community here in Attleboro who is so generous and willing to help any way that we can. There's a stigma, but there shouldn't be, and we're trying to work to break that stigma because we are all in this together, and Attleboro is at our best when we come together. That's what we've done straight throughout this pandemic. Finally, I just want to say thank you to Dan and Linda McKerney, who hosted a food drive for St. Vincent de Paul this weekend. So they're going to be able to continue their annual Christmas meal at St. Vincent de Paul, which is something that a lot of folks in the community have come to rely on. And as I wrap up, just a big thank you to healthcare workers, Attleboro Fire Department, Attleboro Police Department, all of the military, because the military was engaged, National Guard's engaged in a lot of different aspects to help fight this pandemic. So thank you to all military. And as we heard earlier, the leadership of the schools, and especially the teachers. Stay well, stay safe, everyone. Thank you.
Excellent, Jay, and thank you for mentioning that COVID. If somebody needs help, ask for help. COVID-19 isn't anybody's fault, and it's important that people, if they need something, understand that there's a lot of people that are looking to help. So thank you. It's, again, always a pleasure.
Pleasure's mine. Thank you.
And Kathleen.
I'm here to close.
Yeah. So
Yes.
So you started to share a story with me, and I think it's a great story to share with everybody. So the floor is yours.
Thank you. And I think it's interesting because some of what I'm going to say is both completely in line with and contrary to things that were previously said this evening, which points to the very precarious, predictable nature of the situation we're in. So my son recently is recovering from having COVID-19. And he contracted it in what we thought was a safe environment at a school where he was taking music lessons. He was wearing masks. What I failed to appreciate at the time and have realized now, and I'm fairly certain he got it there because we had shrunk our envelope. We were minimizing our risks and our contacts and being reasonably safe. And I say reasonably because, look, I wasn't completely inside the house, but we were going out cautiously. But what I realized, and I want to point out to anybody who's listening, is one, masks are not enough. There's a lot of emphasis on masks. He was masked in this environment, but there were two other important factors of this three-legged stool that were not perhaps adequately being enforced. One is distancing, and two is ventilation. If you're in a small space long enough in close contact, even a mask will fail at some point, particularly when you're in the presence of people who are actively shedding, and that appears to be the case. And I kick myself to some degree. I did have some parental guilt for not evaluating that location a little bit closer. But I guess I too put too much reliance in masks and comfort and wanting to keep things normal and having that social outlet. So I feel a little bit guilty about that, but I'm not looking to blame anybody. I'm looking at this as a learning opportunity. Like, yeah, mask, but don't forget to stay away and don't forget to have a window or a door open because those are equally important. And as Dave Sawyer said, the school is succeeding because it's doing all three, because it's required to do all three of those things. Not one, not two, but all three. And that's where the magic lies. All right. So I wanted to emphasize that point. And not to forget about contact and touching things, because that too is still very important. And I feel like the longer that this goes, my family perhaps fell into a little degree of comfort and security, because the more you go out and do stuff and you don't get sick, the more you think you can do. And that's a very, very dangerous calculation. The second thing I want to say is that the situation made me reassess the risks in reality. So fear in the abstract is one thing. I don't want to get that. But when it comes to your house and someone that you love most in the world has it, it's a whole different ballgame, people. Because although I had a general feeling that because of his age and because of what I understand about the virus, it would be relatively mild, there's a window there, guys. You don't know that. You don't know in the first 24, 48 hours how this wild horse is going to run. And that's exactly what this is, because it's an unknown quantity. And I trust experts, but no one can tell you exactly how it's going to hit you or you or you. So it's very humbling. So let's not get too comfortable with this idea of it's mild. You know what? You don't know that. Do you want to put your kids, you don't want to be there. You don't want to test that. So we were humbled, and it was a very scary few days, but it did prove to be mild. But don't take that for granted. And Rachel Maddow said some very interesting comments last week about her partner who got it, which is that, you can assess the risk for yourself, but consider the risk if the person you love most in the world gets the virus. Is that what you want? And I assure you, you don't. All right. So we just got through that. So I would highly suggest to people, reevaluate your risk calculation, what you need to do, how important it is to you to do it, and are those three legs of the stool properly and equally in place. And lastly, what we're coming into, and I certainly defer to all the experts who came before, this is a perfect storm. We're going inside for the winter months. The holiday seasons are upon us when people have the most desire to be with other people. And we're also meeting up with fatigue. I think it was Senator Feeney who said, it's been a long haul, guys. And by the way, there's a vaccine on the horizon. So maybe I'll roll the dice because it could be here in a few months. Absolutely not. This is time to double down and hang on because you want to get there and you want to get there safe and healthy. So I fear that people might hear vaccine and all the wonderful work, and I put my full faith in smart people. So glad I live in Massachusetts. We'll get there, but now's not the time to start having the parades. We've got to get there. So those are the three things I wanted to share is don't get too comfortable. It's a three-legged stool of what works, and they are all equally important. And never stop asking yourself how important it is me to do this action or to go to this place, and what does it look like there? And one more thing, some people are good at this, some aren't, is assessing their risks. It's not something that some of us are used to doing, but I highly recommend people do something as simple as a decision tree and go through the work for every time you leave your house. Have an exercise where you ask yourself certain questions to assure that you're not getting comfortable, you're not taking it for granted, because I think that's what we did. And I regret that. Luckily, we got away with that mistake, but I wouldn't want anybody else to be in that position. So I thank you for having me on, Todd. I think it's a perfect time for this show as the numbers go up. And it's just, there's a perfect storm shaping up here. So I'm particularly nervous about what could happen. So thank you.
Thank you, Kathleen. And I think that's an incredibly important and powerful message to remind people of. And as you were telling the story, the thing that kept going through my mind was deployments overseas. And it was always that last month of the deployment when complacency really kicked in. And that's when people got hurt. That's what, like, there were certainly issues. And yeah, we're here in the last, hopefully the last few months of this, and we can't allow complacency to creep in. And so it's such an important message, and thank you so much for sharing that. So that wraps us up for tonight. Does anybody have anything else to add or to share?
Stay safe.
Stay safe, yeah.
Stay safe, everyone. We're
Thank
here
you,
for
Todd.
you. Thank you so much.
Thank you very much. Thank you, guys.
Have
See
a
ya.
good one, everyone.
Bye.
Thanks.